5, 4, 3, 2, 1. Welcome this afternoon, and thank you for coming out on such short notice. And without further ado, I'd like to introduce our mayor, Mayor Kyle Deaver.
Thank you, Michelle. Thank you, Larry. Good afternoon. First, I want to announce that in connection with the CDC's revised recommendations for limiting the size of community gatherings and to reduce confusion by coordinating with the declaration made by McLennan County today, we are amending our emergency declaration so the maximum number of persons permitted to be in a community gathering is reduced from 50 to 10. This will become effective as of 11:59 p.m. tonight. Secondly, I want to thank the McLennan County Commissioners Court and the Governor for taking decisive actions today on COVID-19. COVID-19, like all other contagious diseases, pays no heed to jurisdictional boundaries. The only way to get ahead of this disease is to take strong preventive action across a large geographic area. The quicker all communities take these kinds of actions, the better chance we have of getting ahead of this disease and getting on the path to recovery, both from a public health standpoint and also for our economy. We need to take dramatic and sometimes painful measures now in order to make our situation better in the future. I want to announce that Ascension, Baylor Scott & White, and the Family Health Center have all announced that they will work with people who do not have a regular primary care doctor or who do not have insurance or both. Please contact them for more information. Now I want to tell you where we are in Waco and McLennan County as of this afternoon. As of 12:30 p.m. today, we have 7 confirmed cases. 6 were from yesterday, 1 from today. As far as testing, there have been 2 tests sent today to the Department of State Health Services lab. There are 8 tests pending results. Hospitals and clinics have the ability to use commercial labs without contacting the Waco-McLennan County Public Health District first, so there are other tests that are likely pending that our health district is not aware of. We have 1 new case today, which brings our total to 7 cases. We have determined that 1 of these 7 cases was acquired locally. This means that person-to-person spread, also known as community spread, is occurring now within Waco and McLennan County. Because our community is early in this outbreak, we have the opportunity to dramatically reduce the spread of this disease and its impact on our community by taking action now. Here are some vital things that we all need to do now. If you have symptoms of COVID-19, those being fever, cough, shortness of breath, and other flu-like symptoms, immediately self-isolate. This means avoid all contact with others. Go home, stay home, and contact your physician. Your doctor can determine if you need to be evaluated by phone or in person. Your doctor will evaluate you and determine if you need a test. If your doctor tells you you don't meet the criteria for testing to confirm COVID-19, you should act as though you have COVID-19. That means you should continue to self-isolate, stay home, and avoid contact with others until recommended by your doctor. Do not go to the emergency room unless you feel your symptoms are severe. The most common symptoms of COVID-19, as I just said, are fever, cough, shortness of breath, and other flu-like symptoms. If your symptoms are due to COVID-19, you may be giving this disease to others before you can be evaluated. People are already contagious as they become symptomatic, that is, as they develop symptoms, and they may be contagious for a short time before they develop symptoms. This is why self-isolation immediately is so important. This will help slow the spread of the virus and flatten the curve of the number of people infected. Now I'm going to turn it over to the Spanish translator. We'll clean the microphone again, and then she will give you the translation, and then we will be available for a few questions. Thank you.
Buenas tardes. Estamos colaborando con el CDC y hemos repasado las recomendaciones acerca del límite de personas que deben de asistir a las reuniones aquí en la comunidad para evitar la confusión que repasamos ayer las declaraciones de estado de emergencia. Estamos haciendo cambios para evitar que personas se reúnan que sean más de 10 personas a la misma vez. Este cambio será efectivo empezando a las 11:59 de la noche. También quiero agradecerle a los oficiales de la ciudad y al gobierno por tomar estas acciones. Como otras enfermedades contagiosas, el COVID-19, no hay límites regionales. Tenemos que seguir con las pautas para evitar la propagación de esta enfermedad a un nivel más grande. Queremos que la comunidad tome estas acciones y que sigan tratando de avanzar en evitar la propagación y nos podamos recuperar lo antes posible. Por eso estamos tomando medidas dramáticas para mejorar la situación lo antes posible. Ahora, las novedades esta tarde. Desde las 12:30 hoy se han confirmado 7 casos, 6 desde el 18 de marzo y un caso el 19 de marzo. 2 pruebas han sido mandadas al Departamento del Estado en los laboratorios hoy. Tenemos pendientes los resultados de 8 pruebas. Los hospitales y las clínicas tienen la habilidad de usar laboratorios para hacer pruebas al nivel comercial sin hacer contacto con la Subsecretaría de la Salud. También pueden hacerse otras pruebas aquí en el distrito que tal vez no estamos seguros, pero se pueden realizar. Tenemos un caso determinado hoy y ahora un total de 7 casos confirmados. Hemos determinado al nivel local que vamos a seguir con las pautas para evitar el contacto directo entre personas, para evitar la propagación aquí en Waco y en el condado de McLennan. Estamos todavía al alcance de reducir los casos y la propagación si empezamos a tomar acciones hoy. Aquí están algunas cosas importantes que deben de saber. Si usted tiene síntomas del COVID-19, si tiene problemas respiratorios, fiebre, tos o otros síntomas que parezcan como la influenza, inmediatamente apártese y manténgase en casa. Evite el contacto con otras personas, no salga, contacte a su médico y trate de tomar medidas para evitar la propagación. También su doctor va a poder evaluarlo y determinar si es necesario hacerse la prueba. Por favor, traten de evitar el contacto directo con personas. Si usted sabe que tiene estos síntomas, manténganse en casa y evite el contacto hasta que su médico le recomiende que haga diferente. No vaya a la sala de emergencia al menos que usted siente que tiene estos síntomas y son severos. Los síntomas más comunes son la fiebre, la tos y problemas respiratorios y otros síntomas parecidos a la influenza. Si tiene esto debido al COVID, usted puede estar contagiando a otras personas sin haber sido evaluados. La gente ya contagiada va a desarrollar síntomas y pueden estar contagiosos por un periodo corto de tiempo. Por eso es muy importante apartarse y mantenerse en casa, y es muy importante que trate de trabajar con nosotros en evitar la propagación de esta enfermedad. ¿Okay? Gracias por su apoyo.
Okay, we'll take a few questions, and if you will, repeat them loud enough so I can hear over the fountain, and I'll try to repeat them. Anybody have a question? Yes, sir.
Are you able to tell us if the person that contracted today, the virus today, if they work in retail or not?
Can anybody confirm whether they work in retail or not?
The answer to that is that whether they work in retail or not isn't the question. We're concerned about that we have spread in the community now, and whether you were or weren't at a particular store on any particular day is not the thing to be concerned about. If you haven't been practicing the social distancing measures up to this point, then you put yourself at risk. and since the virus is now out there, from this point on, our efforts are to prevent further spread of the virus.
That was the health authority, Dr. Farley Werner. Okay, next question.
In terms of how are you planning to regulate these, the police, I guess, who is meeting in groups of
So who's in charge of regulating and policing the order that's been issued? Excuse me.
We do not have a mechanism for policing that or enforcing that other than by complaint. And this is why it's so important for our citizens to take personal responsibility for this. But if you know of someone that has tested positive or is waiting for a result, and you see them not observing that, I would urge you to call the public health district and let us deal with that.
I might add also that the city's code enforcement department is also the adjudicator, more or less, of the person of authority. Question.
Are there any different things, proactive things that citizens can do now that it's spreading within the county rather than last time?
Anything people can do that's different now than what we've done before? Is there anything different? Or you want to reiterate that?
No, it just stresses the importance. It stresses the importance of social distancing as a measure to overall decrease the number of contacts that occur, the number of times that people are potentially exposed to the virus, and it's really important to focus on that, at least in the near future.
Yes.
The CDC seems to have very tight deadline or tight regulations on who can be tested and who cannot. Are you concerned that perhaps with those tight regulations on who can be tested and who cannot be tested, that we're missing a lot of people who are spreading the disease?
Okay, the question is dealing with testing, and are we concerned about maybe the lack of availability based on the CDC's recommendation versus the supply? Is that kind of correct?
Well, that's it. There's a
Yeah.
feeling that nobody's
Okay.
being tested.
Okay.
The president gets up and says, well, everybody needs to test.
Gotcha. Who wants to handle that? Let him.
Currently in our community, the Baylor Scott and White system, the Ascension Providence system, and the Family Health Center all have mechanisms in place for their providers to have testing done on their patients through their system, and are also working to make sure that that's available to all within the limits of the number of tests they have available now. So at present, if you call your doctor and through that interaction, whether it's by phone, hopefully, or in person, it's determined that you need a test, then they will direct you to their facility where that testing can be done. That's limited partly by the fact that anytime a specimen is collected, that it has to be done by healthcare personnel wearing full protective equipment, which is also in short supply. So it's right now currently not being done in an office setting.
Are tests in short supply?
They have tests available at present, and depending on demand, how long that will last, that assessment probably changes every day. The hope is that as the commercial laboratories increase the number of available tests, that we won't have a period of actual shortfall. But it's important that people without symptoms not seek testing, because it doesn't mean that you're never going to get coronavirus, and it may be that not everyone who has symptoms will be tested, but still should remain, should avoid contact with others during a time that they're ill.
All right. Go ahead and say your question while she's
How many tests are currently available now, and was the turnaround time for those tests is the question.
I don't have a number. You'd have to talk to the individual providers, and they're going to have a different number each day. The Hillcrest Baylor Scott and White system has within its whole system a in-house test that's developed, and their turnaround time, I believe, is less than a day. There are local labs that provide the actual test to Ascension Providence and can for the Family Health Center. Any of those sites can obtain a test through the health department to be performed at the state lab, and those are limited to some degree by workload and availability there, but currently many of the tests here are being done at the state lab as well. Turnaround time for commercial labs varies, 1 to 3 or 4 days. The state lab varies by their workload backlog, and from the time they receive the test until the result is available, 2 to 4 days.
Can anybody confirm that the person that was detected today work at Syntex Marketplace?
Unless a particular person's workplace is felt to be a risk to the public beyond what their risk might be in another setting, then we don't give out personal identifiers, something that's going to give information about a particular patient.
Just repeat the question. You heard it.
Did the case, say it again? I don't know the specifics of that. An establishment can decide to close for its own reasons.
Repeat the question for you.
They're my germs. Whether someone worked in a retail store or not actually does not increase the risk. If it's beyond that in the general community, if there's activity in the community, then it would be because of close contacts And the guidelines at present do not consider a person going through a retail store as what's called a close contact, where you have contact for less than 6 feet for a significant amount of time. And so, no.
Let's take one more question and the mayor's going to wrap up.
Both hospitals are working very, very diligently at this time to be prepared for that eventuality of a larger number of cases. And all that can be done is to maximize readiness. I think most all the communities felt like they had been preparing well, but there are areas in cities in the U.S. now that are having considerable trouble with shortages. It's true that masks are and respirators are in critical supply already, and I know people are buying things online, respirators. If you have a N95 respirator, it doesn't do more than a regular mask for any use you might have, and I would suggest donating any unopened packages to your hospital.
All right, that's all the questions we'll take. I want to say a couple of things before we go. First, it's important for you to recognize that none of the cases that we have reported so far have required hospitalization, and none of them have reached that level of seriousness. And that I just validated that information. That obviously can change. I also wanted to recognize the hard work that the city is doing to keep everybody informed, including having American Sign Language interpreters for each of these press conferences. Appreciate you being here, and Spanish language translators. We want this information to get to everybody that needs to hear it, and so we're taking every action we can to do that. We don't plan to have press conferences every day. Things have been changing rapidly. Hopefully we won't see you again until sometime next week, but we will do everything we can to keep you informed, and if something changes, we'll call another press conference if it is of that magnitude. I want to tell everybody to just be safe, take care of each other, and take care of yourselves in this trying time. We will get through this. Thank you.
Solo quiero volver a asegurarles a todos en la comunidad que estamos colaborando con las agencias estatales y vamos a hacer lo mejor posible para poder evitar la propagación de esta enfermedad. Quiero reconocer a todos los oficiales, los profesionales en el cuidado de la salud y a toda la comunidad que está cooperando con nosotros durante estos momentos. También estamos tomando cada acción necesaria que sea por el bienestar de la comunidad y vamos a mantenerlos informados de los pasos, de los cambios, y si tenemos novedades los vamos a compartir con ustedes. Gracias.